Hi everyone, welcome back to another virtual session with Fresh Dental Shadowing. Today we have Dr. Rosen with us, and she's a general dentist, and you can start whenever you're ready.
Cool. Hi, hello. So what I was going to do today is I'm a general dentist, so I tried to figure out what I would want someone to give me a talk on if I was an undergrad getting nervous about applying to dental school. So I focused it a lot on undergrad, what I did there, and also how I chose general dentistry, but feel free to ask questions about, anything else as I go along, just because I feel like I did my best to guess, but you never know. So first off, my journey to becoming a dentist. So I'm from Delaware originally. I grew up and I was lucky enough to have a dad who's a general dentist as well. So I feel like that took a little bit of the guesswork out for me. Truth be told, I was told for years that I would make a great general dentist. And I said, I don't want to hear it. I like medicine, but how do you know that I'd be a good dentist? So I tried out everything else besides dentistry. I tried out plastic surgery, emergency medicine, where I passed out in the emergency room. So don't be nervous if you think things gross you out. Very embarrassing. I tried out nurse practitioner, physician's assistant, so many things. So that was a good experience. And then for undergrad, I went to University of Delaware. I majored in exercise science. I didn't necessarily, like bio, but I liked exercising. And it got all of the requirements done for me. And then in my gap year, I ended up working in a dental lab, which was fantastic because as a dentist, you work a lot with ceramicists, making things. And it gave me a different insight into how my life would go day to day working with someone who never gets to see teeth. That was a big deal. So we can talk about that more later. For dental school, I went to Tufts in Boston. And then I decided to do a residency afterwards, and I went to Chicago and did that at Northwestern. Okay. So undergrad, I feel like, this is a little bit specific to my experience, but most of this can ring true for anyone at any school that you're at, okay? Don't worry about picking, if you're a freshman or a sophomore and you haven't declared yet, do not worry about necessarily picking a major that's bio or chemistry or, pre-dental, whatever that is. Pick something that you're going to find interesting. Pick something that you think that you're going to enjoy. I tried out international relations. I took econ and was like, this isn't it for me. I took some art history classes that I loved, but in the end, I chose something that did help me with the requirements. Just know that if you pick something other than something that's science-based, you're just going to have a lot more work. You might end up taking more credits than, is ideal for a semester. And you might also end up staying an extra year to take extra classes. I ended up myself doing that, and that's totally fine. But just choose something that you enjoy. I think that that's easier to explain on an application when they say, why did you major in this? And you're not like, well, I thought that it was good for dental school. Just, have interests. That's okay. Time-consuming labs, I would recommend taking during the summer. Chemistry, biology, physics. Physics. Hated it. Didn't take it in the summer, but it's the sort of class that if it's going to be really time-consuming and you're worried that it's going to take away from other things, take it in the summer. That's totally fine. I will say, don't take science and lab classes at community colleges. They don't transfer to dental schools. So that's just an important side note. People ask me that a lot, and I've never found a dental school that accepts those credits. Well-rounded. So you'll hear that a lot. They're like, oh, we want to see well-rounded candidates. But what does that mean? So if you get involved in something your first or second year, let's say you join Greek life. Let's say you join, what was I involved in? The sailing club. I tried that out. It didn't go very well, but I tried it out. It's not so much that they want to see that you did sailing, for instance. They want to see that you did sailing and that by the time you were a senior, you were involved in planning the sailing trips. They want to see that you actually advanced to a point that you took leadership roles. That's super, super important. And I'm not, just so you know, I'm not just saying this from a place of like, this is what I hear. I was an interviewer when I was in dental school. So I genuinely know what they're marking you on. This is like, it's very across the board. Leadership is really important. Okay. So showing interest in healthcare and specifically dentistry is important because, and I'll give you an example of this. There was someone who I interviewed once who we said, why do you want to be a dentist? And all they could say was, well, my family member's a dentist. They said that I'd like it. They said I should do that. It's a good job. And we were like, okay, so like, did you do anything in college that, you know, was medical related? And they kept saying, no, but I really like playing, you know, it wasn't this, but like hacky sack with my friends outside. Nobody plays hacky sack, I get that. But, you know, it was along the lines of, you know, I really like these other activities, but I have been told being a dentist is a good job. So that's fine. It is a good job and people really like it. But if it's not for you and you haven't shown interest in it, you're not likely to be a candidate that they want, because there's someone out there who, even if it wasn't dental specific, they volunteered at a medical center. They did something that was healthcare related, and that's very, very important. If your grades are a little bit lower, that's okay. You don't need a 4.0 GPA, but what you do need is to make sure that you can explain why it's lower. Were you so busy doing other things and running all of these different clubs and, you know, starting a new club or whatever it was that your GPA dropped a little bit? That's okay. You know, that's totally fine. For me, I knew that I was never a great memorizer. I can study something for 3 weeks that other people can study for a week. So for me, I was like, well, why would I study those 3 extra weeks when I can get more involved in clubs? And I know that the schools are going to like that. And that philosophy paid off well for me. For instance, I wrote this down because I thought it was funny. I helped start a dental club that donated toothbrushes and supplies. I don't remember what the name of the club was now, but you can do something like that where you help start an initiative when you're in school, and that's kind of fun. That's University of Delaware. I thought that was pretty. I will say I jumped in that fountain with one of my closest friends from school for graduation photos, and we started a trend and everyone started doing it. It was very fun. We think we were the first, so I'm going to take credit and say that we were the first. I have no proof of that. I don't know if any of you guys have ever looked at this. This is a list of requirements for dental schools. This is Tufts. I would just keep this in mind as you're going through. Even though I majored in a science-based major, exercise science, I still didn't have, what were the 2 that I was missing? I was missing biochem and microbiology. Tufts doesn't require microbiology. I mean, maybe the upper level biology is what that was talking about here. But basically, I ended up taking a pseudo victory lap to take those 2 extra classes because I knew I wanted to study for the DAT anyway. So keep this in mind from kind of the beginning, because you want to make sure you can fit all of these in, and you don't want a semester where all of a sudden you're taking, you know, too many of these at one time. Enjoy yourself, spread them out a little bit. Hold on, my screen is blocked by my face. I kind of already said a little of this. The gap year, I did study for the DAT. That was totally worth it. Oh, this is, okay. So I know from my own experience and with a lot of my other good friends who have gone into the medical field, something that really freaks out undergrads is the idea that you're going to be older than 22 or 23 when you get into dental school. I remember thinking, I can't take a gap year off if I don't get in, or if I, you know, need to, I don't know, if I don't get in, or if I need to take more classes or whatever, taking a gap year is going to be a problem. It's going to look bad for me. No, it's not. Take your time. It's totally fine. I took a year off and was still one of the youngest people in my class. Like, it is so, so fine. So don't stress about it. You know, I want to say that I probably on average saw the people who even took time off maybe did better in dental school because they were a little bit more focused, and they, you know, I don't know what the reason was, but I just don't worry about it. If you are one of those people that is looking at this saying, maybe you want to save money for a year, maybe you want to move home, and work and start out dental school with some savings, that's a great reason to do it. So don't stress out about it. Lots of students take at least a year off. Some, they worked in a completely different field and then we're like, maybe I want to be a dentist. So they do 180. Okay. Next, let's go on. Oh, I just wanted to reiterate this. You know, you don't need a perfect GPA either, but you do need to have a good reason why it wasn't, you know, a 3.7, 3.8, you know, let it be a little bit lower, but show that you're a go-getter, show that you're invested in dentistry, show that you, you know, make sure everything else is there. So, all right, during dental school. So you get in, what are you going to be doing? Okay. These are 2 photos from Tufts. I thought this was so funny. I think these are both people from my class. Like, I know the bottom one is because I can see everybody, and this is a meditation class. And you can't see that everyone, well, number one, you can tell a lot of people didn't go up to class that day because the auditorium is really empty. Usually all those seats would be full if everyone was in class. But they used to have us do this because dental school is really stressful. So it was kind of a cool bonus. The top photo is our simulation clinic, which was really cool. State of the art. You had these mannequins that were absolutely terrifying that you would basically assemble with this like silicone fleshy face. And then you'd stick I didn't know what a typodont was even when I started dental school. You know those fake teeth that open and close? Yeah, that's a typodont. So you stick that inside of this fleshy head and you work on it like it's a normal patient. And the chair sits back, you've got an air water syringe, you've got a foot pad, like it's just like a dental thing, except you've got this really creepy looking patient. And we used to name them, I think mine was like Hedward or something bizarre. I don't know. Their mouths wouldn't open enough. So we'd all try to, you know, play the system by making little slits like the Joker in the sides of the mouth so we could get the mouth open more so we could see what we were doing because we didn't know what we were doing. There was always that one person that had it sitting like completely up and they're looking in the mouth and doing it, just ridiculous. Anyways, so these are pictures of my class doing things and I found these on Google. So I didn't have these specific photos, but when you get to dental school, I think it's like undergrad. I think you look back and you realize that you were so nervous to get involved in activities. And then you think, why was I nervous to get involved in activities? Like the older students aren't going to care. You know, we're excited to meet somebody new too. So jump right in. Even if you don't know anyone who is part of a club, you know, the reason other people are part of that club is because they wanted to meet people. So some of my closest friends in dental school were in different years from me. It was wonderful. So get involved early, just sign up. Research is something that I did in undergrad and didn't want to do in dental school, so I didn't, but a lot of people get involved in research. Activities, trying to think of what kinds of activities. I was involved in a dental fraternity and it was a little bit more of a social thing, but it ended up helping me get a job afterwards. It facilitated me going to some talks. It was cool. Yeah, I enjoyed myself. I ended up being on the executive board. I joined as a member, then was treasurer, vice president, and then president. So I wasn't at the top of the class academically. Like I said before, literally my memorization skills leave a lot to be desired. And sometimes you walk into dental school and you feel great, you got in, you're like, I'm so smart. And all of a sudden there's 200 people smarter than you. And that's totally fine. That's so fine. For me, I was at the top of the class clinically. So when we did hand skill stuff, like in the simulation clinic in that top image, that's where I really excelled, which made me feel better about, you know, the library meltdowns, which is totally fine. Study with your friends, teach each other things. The people that you study with might not be your closest friends, but you end up studying so much that I ended up becoming best friends with all the people I studied with. It was fantastic. I did live 2 blocks away from school, and I highly recommend that. I know sometimes, depending on what school you go to, it can be a little bit more expensive, but when you're leaving the library at 3 in the morning and you don't want to get on public transportation or pay for a $20 Uber, or you don't want to, you know, whatever it is, it was worth it for me. Also really important to have a healthy living environment. And for me, that was my roommate who I lived with for 4 years, and she was fantastic. So Not everyone, I actually don't know hardly anyone that had the same roommate all 4 years. I got lucky that that was my situation. But, you know, take it seriously, vet people, think about, do you want to have a crazy partying fun roommate in dental school, or would you want to have someone who also is a dental student who you know is going to be also coming back from the library really late at night? So that's important. All right. So in the end, you end up choosing what you want to do. And for me, I chose general dentistry. I love it. It's different than all of the other specialties, you know, of course, that's why you do it. And for me, when people said, why would you choose that? You know, do you like anything more than the other stuff? I didn't, and that's why I chose it. I really like all of the procedures. There wasn't one that stood out to me necessarily. You can always specialize later. I know that there are some specialists that I know that after 5 years in private practice decided to go back and become an endodontist or a pediatric dentist or whatever it was. I think that those are a little bit more common. I don't know as many people who, you know, 10 years later become an oral surgeon or do perio, but I think that that's just what I've seen. So it doesn't mean it doesn't happen. Most general dentists can work only 4 days a week. This is so important because when you are deciding to become a dentist in the first place, one of the big perks that people will talk to you about is the lifestyle. I actually have a funny story about this. When I was trying to decide if I wanted to become a dentist or something else, I hadn't settled on dentistry yet. And I was in surgery. I think I was shadowing the physician's assistant for an orthopedic surgeon. And the surgeon in the middle of surgery, I don't know if he knew that my dad was a dentist, turned around and went, and I was kind of grossed out the whole time. I was like, there's bone flying everywhere. I hate this. I made a huge mistake. And this guy turned around and he was like, you need to become a dentist. That's where it's at. And I remember thinking, oh, no, did my dad pay you to say that? And to this day, I mean, he's on here, he could answer. I don't think that there was any sort of discussion that led to that comment, but I think that a lot of different people in healthcare, one of the reasons that they like dentistry is because we do have a really nice balance, like life balance. If you want to be your own boss, you can own your own practice and be your own boss. If you never want to do that, that's also fine. You can work for someone else forever. That's totally fine. Flexible schedules. If you wanted to, you know, let's say that you're an early bird and you want to start every day at 7 a.m. and end at 3 p.m. Maybe you're a parent and you want to pick your kids up from work. Do that. That's totally fine. It's very customizable in dentistry. It's pretty chill. Let's say that you're you know, the kind of person that hates the weekend. Oh, and I don't know who would, but they want to work Saturdays and Sundays, and maybe you want Wednesdays and Thursdays off instead. That's fine too. So there's no rules. One of the best things about general dentistry is that you get to know your patients over time. So even more so than someone who goes and gets a physical every year, right? We're seeing our patients at least twice a year. If they have fillings, we're seeing them more often than that. Other specialties do not have that luxury in a lot of ways. Pediatric, yeah, but for endodontists, someone comes in for a root canal, they've got you know, their mouth is isolated with a rubber dam, one of those big blue things, usually blue, that they can't talk the whole appointment. So they're not getting to know the patient necessarily. Oral surgeons, you come in, most of the time you're under some sort of sedation to get a tooth out or implant placed or whatever. You're out of there, you probably never see them again. So with being a general dentist, it's a much different thing. So I really like that. Some days you play therapist a lot, and I think that that's happening a lot right now with COVID, because people haven't been out of their house in a year and they go to the dentist, and people all the time say to me, they're like, I showered just to come in today. And I'm like, thanks for telling me that. But it's very fun, and I absolutely love getting to know people. So it's been wonderful, and I highly recommend that aspect of general dentistry. All right, so after all of that and dentistry, I decided that something that was important to me was to do a residency, which is actually optional with dentistry. You don't have to do one at all. That's a big perk. There were students in my class who were, you know, in their 40s, and they didn't want to do a residency. They were like, I'm ready to get out and make some money. Great. Don't have to do anything at all. You are a fully qualified dentist when you leave. I will say that it's not necessarily recommended in certain situations. If you are going to try to get a competitive job in a city, you should absolutely go into dental school knowing that you want to do a residency afterwards. You get way more experience, and people will take you to an extent more seriously on applications because they know that you had another year of training where you got your butt kicked and did a ton of stuff. Okay. So I chose Northwestern Memorial Hospital in Chicago. I chose it because I had 6 interviews, I think, for residencies. And out of all of them, this one was the one that I was going to die the most in for a year, which was my goal. Because I was like, it's just a year. Where am I going to learn the absolute most? And I was spot on. And there were a couple of reasons I did this. I chose a program where there were only 2 residents. So I wasn't splitting work between 12 residents, which is what some practices, some residencies are like. So when things came in, it was just her and I that were doing it. The downsides of this is that because it was a hospital-based residency, you're on call every other day and every other night or every other day, every other weekend for a year. So that was the worst. I'm going to be honest. That was atrocious. There were weeks, and if the other person goes out of town, it's you nonstop for a week. So I didn't love that aspect of it, but I got great experience out of it, which I loved. And would I do it again? No. But am I glad I did it one time? Yes. I wouldn't sign up for it a second time, but the first time was fantastic. This is more than a lot of you guys need to know because this is like, a ways down the road. But the reason I chose this type of 1-year general dentistry residency versus another one that's offered is that this one's hospital-based and that one's clinical-based. So that one's just, you might be in a community health center or something. It's not a hospital. So for this type of residency, I also did rotations in oral surgery, radiation oncology, anesthesiology, and the emergency department. So fantastic. I learned in oral surgery. That was cool. I just, really enjoyed that. That was fun to see. Radiation oncology, very interesting. Radiation oncology is where people who have head and neck cancer and other types of cancer as well, that's where they go to get their radiotherapy, so radiation dosages. So we ended up working with a bunch of wonderful oncologists there, and they walked us through how they map out where to give the doses of radiation to. And for us, that's important because when I have a patient who comes in who has oral cancer or, even like, here up, if they're getting any radiation that affects the mouth or they're swallowing or anything, I now know how to deal with that. And, they could consult us and say, this patient has a tumor in their mouth. We'll talk about it. I have an example of the case, but it ends up being really important for a dentist and a radiation oncologist to work together, which is very cool. Anesthesiology was really cool. Probably one of my favorite rotations because it was just totally different than anything I expected. You follow around anesthesiologists and you can go into any OR that you want. At least that was my experience. And I realized that I really don't like a lot of surgeries. I didn't want to be a part of it at all. There's some really gruesome surgeries out there. I tried to watch a neurosurgery one day and I was just like, listen, this has been really fun. I'm out. I didn't like it. I did get to intubate a few patients. So that was really cool. When you intubate a patient and everyone's standing around because they're like, the dentist is about to do it. And you're so excited you want high fives when you're done, you're not going to get high fives. That is not the vibe in the room. So anyways, very, very fun experience. And I feel very lucky to have been able to have done that. The emergency department is really cool. That was fun, especially because they consulted us all the time being on call. Someone trips after dinner, someone, I don't know, any sort of thing. They bust their face open. We would get consulted anyway. So then I was getting it from a little bit, the different perspective of, how are they triaging patients? How are they deciding to call us in the first place? Emergencies, we got lots of emergencies that we were called in for. Broken jaws, fractured teeth, abscesses all the time. That was my favorite. People just being concerned that something funky was going on in their mouth. We would get called in for those. So any sort of thing. I got to work with patients whose work was subsidized. So you can imagine that in a private practice in dentistry, when someone comes in for a crown, it might be anywhere from, $1,500 to $2,000 for the crown. I was doing them for $200. So even though that was a lot for the people I was working with because they came from a more low-income community, I got to do a lot of work because people hear, oh, a $50 root canal? Yeah, sure, do that instead of take out my tooth. So that was a big deal. So, and I touched on GPR versus AGD, and those are the two different types of residencies. So, residency examples. All right, so this is an example of what you would see if you got called. Let's say your pager goes off at 3 in the morning, and you're just like, no, it's not at all what I wanted to hear, but too bad. You're going in, and this is what you see. And he has this huge lump on his cheek and he has no idea what it is, but his mouth kind of hurts too. So they called you. What you would do is you request the radiographs that you need. This time you'd request a 3-dimensional x-ray. And then you could consult oral surgery because this ended up being a case where this guy needed to actually have this drained. Little did you know that a tooth infection can present as a huge pimple on the side of your cheek. So delicious. I used to joke with the emergency department people that I didn't want them to call me at 3 in the morning unless it was a juicy one because I didn't want to have to wake up for it. So that was a juicy one. This is really interesting. So this is an example of oral cancer. This was an oncology consult because the patient was about to get treated for this cancer. And so you can obviously see that. Can you see my mouse? Okay. So this whole area, you can see visually, that it's completely changed. Just so you know, those of you who maybe were like, what's wrong? I don't see anything different. That's not supposed to be there. So this all needs to be removed. That's all tumor. And it actually had extended under the jaw a little bit. So in this case, what we have to do as dentists is to say, well, any area that's going to get above a certain amount of radiation, those teeth need to go, because what can happen is that you can get these horrendous bone infections by radiating an area of the jaw. And that is really difficult to manage medically. People end up having worse complications from that than, they can end up losing part of their jaw from the complication of just the radiation, even if they didn't need a part of it taken out because of the tumor. So we just have to be the bearers of bad news sometimes and say you're going to lose a couple of teeth before you have your treatment done. Okay. This was a really interesting case that I saw. So this was a consult from the hospital. This guy came in and they were unsure what was going on. We were kind of a last resort call. He was an older gentleman who they thought that his cancer had returned because he had completely stopped eating. And they were trying to decide if they should call palliative care or not. And palliative care are people that you call like hospice when someone's prognosis is bad and they're not going to make it and they're going to just stop trying new treatments. So what ended up happening was that no one realized that this guy had a denture in his mouth and it hadn't been taken out in, I'm guessing months here. I wrote months. I have no idea. Who knows? This thing was in there for so long. I'm so sorry if you're squeamish, but I can tell you when you walked in his room, it smelled like a brewery because the yeast from the candidiasis infection was so intense. So anyways, we got him squared away. After we got this cleared up, I don't know what happened with the cancer stuff, but it was a pretty wild case of candidiasis. So I thought I'd show you these 3 gross things. If these kinds of things gross you out, just so you know, this is important. Don't worry. You don't need to be like, that person that's like, I can't get enough of gross guts and stuff. You don't need to be that person. That's okay. You know, you get more used to it over time. You get a little bit desensitized to it. You know, everyone's about to pass out when they give their first injection. That's totally fine. You know, I passed out when I was shadowing that time I said in the emergency department. It's embarrassing. Am I happy that it happened? No. Do I still cringe? Yes, but it's fine. It's fine. So I can take teeth out now and that doesn't gross me out. So there's obviously, you know, there's a process to it, right? So the desire to be a good dentist is, I think, number one here. The rest of it comes later. So working now, what am I doing now? Let me tell you. I'm doing a lot of patient exams, fillings, crowns and bridges, removable, things like dentures. We do Invisalign, Botox, and fillers. I don't do yet, but I probably will at some point. That's a big thing in cities for dentists to be doing. Endo, so things like root canals. And then I see a lot of emergencies. And I take out teeth, which is fun. See, now I think it's fun. But before, I used to be like, whew. When I took out my first tooth, I think I freaked out. I'm going to be honest. Needed someone to hold my hand. There's still dentists to this day. There are great, amazing dentists that don't take out teeth. So don't feel like you need to be a savior. The requirement in dental school, I think, was taking out 10 teeth for graduation. And I promise you, there were probably a few people who had someone holding their hand while it shook the whole time while they took out a tooth. And they were like, that counts, whatever, it's fine. You know what I mean? Like, if that's not your part of dentistry, that's probably fine. I'm sure that there's ways to work around it. Okay, so I wanted to do a bunch of examples of work because I think this is the most fun part of dentistry, is actually seeing, you know, let me see how we're doing time-wise. Am I talking too fast or too slow? No, I'm okay. So here are some examples of things that I do, which I think are really fun because that's, you know, it's fun to read about things as bullet points, but it's more fun to see how people's smiles get bigger after you give them nice teeth. So these are examples of dentures. On the left side, we have the befores, and on the right side, we have the afters, just to make it perfectly clear. I don't have anything else to say about this. This was really fun. You know, these people, the guy on top, those were all of his natural teeth. And, you know, you can see that things have moved into the wrong position. When people have a lot of bone loss, that's what happens. Teeth, you know, we picture them being in cement, never moving, and that's not the case. There's a ligament around your tooth. So just like your arm has ligaments and things, your tooth has a ligament. So that moves, and also your bone is constantly changing and remodeling itself. So if things are not happy and healthy, they move out of place sometimes. The bottom picture, that was an old denture, and it was super worn away, and we did a bunch of work on the bottom that was like, you know, crowns and stuff. That's beautiful. I didn't have a good picture of that, so I just showed you the top one. But she was ecstatic, and I love that. So crowns. What are crowns? So the best way I describe a crown, if you don't know what one is, and that's totally fine, is if you have a red M&M and you make it a green M&M. The same stuff is on the inside, right? It's still chocolate on the inside. You're just taking off that outer layer and replacing it with something else. And it's good for a couple of reasons. It can strengthen the tooth if the tooth was weak because maybe it had too many fillings or something on it. But one of the things I like about crowns is that they can be really beautiful. And maybe someone doesn't even have anything wrong with their tooth. Maybe they just don't like how it looks. And that's another good reason to do it. So I like this one on the left because I just think that you can't tell that easily which one it is. I thought the color match was superb. And I thought the anatomy was really good too. So really, I got really excited about it. The one in the middle, I inherited that case from someone else. So when I met them, they were in temporaries like that. And we loved that was the day that we inserted the crown. So there's still that little black triangle right there. So usually, sometimes they linger, sometimes they fill in, but we were very happy with that. And the one on the right was in progress still when I finished up with her, but we were happy with that too. So kind of cool examples. This is an example of both an emergency and composite. So composite is different than a crown, right? Composite is what your fillings are made up of. It's a tooth colored material. So she had broken her tooth, and obviously now's not a bad time to break a tooth because we're all wearing face masks, but still not ideal. A lot of zooming, obviously. So we fixed her up and it looked great. Okay, I added a couple things here because I think that there should always be people that you look up to, right? So for me, there's people that I follow on Instagram that I'm completely obsessed with their work. I do pretty well for a dentist who's been out for only, less than a year out of residency, but I cannot wait to have work that is this quality. This is just, I think, beautiful. So this is this guy that I follow. He's a ceramicist, actually. So he's making the crowns and bridges he's making for dentists. But I think his work is beautiful. And I think that by following along with people whose work you really admire and respect, it makes you get pickier about your own quality of your work. And, for instance, if you look at this one on the left, I love that someone might at first say, okay, this is, if you just look at this tooth over here, we're matching it. Okay, let's just match this color up here. Well, once you realize what he did and you notice all these beautiful little colors down here that really made, and this right here, this gray, these all made a huge difference, right? This tooth wouldn't look like this tooth without all of that extra stuff he put in. There's even this line down the front. He put a crack in the tooth, like a fake one, but you know what I mean? So I think that this is, this one over here too, I love it. I think it's so cool. So my preference is very, hyper realistic dentistry. I think that people don't all need the Hollywood cookie cutter smile. People come in and they say, my last dentist told me that I needed to move this tooth because it's out of place, but I've always kind of liked it. Great, keep it. If it doesn't bother you, don't change it. If it does bother you, it's easy to fix. But I like that this person keeps that person's own characteristic in their smile. So I thought it would be fun to share with you guys because if you like that too, he's a good find. Anyways, I think he's based in Boston too. So go Boston. This is another person, and he is a young dentist from, I want to say, Wales. I could mess that up, but I know I think he's from the UK. But he is also wildly talented, obviously, and he teaches some classes through Cosmodent, and I wrote that here because if you're looking for random videos to learn about how to do things in dentistry, and it might be too early on, but we all have lots of free time these days, so whatever. They've got some cool stuff on their website about making things out of composite, like I did with that girl that broke her front tooth. And I've learned a ton from watching his videos and watching the other videos on that site. He does really great dental photography, so he's documented his work fabulously. So I like looking at his work because it, again, makes it easy for me to say, I want to make my work look like that. So anyways, I thought I'd share those two with you. And I think that's all. Listen, if you have any questions, anyone, and obviously you can ask them now, but if you want to ever ask me any questions that you're too embarrassed to ask now, that's totally fine. Message me on Instagram, happy to help. And that's all I've got for you guys today.
Thank you so much, Dr. Rosen. That was absolutely amazing. I love that presentation. I think that was like such a different perspective than you hear from other doctors, and especially like the getting grossed out about images and stuff. Because trust me, I always get grossed out.
Okay, that's okay.
Yeah.
I mean, it doesn't mean that you'll get over it. I also think that here's the interesting thing. So I'm a pretty anxious person, right? I'm definitely not, you won't catch me dead on a roller coaster, okay? I don't like adrenaline stuff, okay? But when you're the one doing the procedure, like when I was watching extractions before I ever did one, when I was watching injections before I ever did one, oh God, I was so nervous. I was like, this is what I have to do? Oh God, no. But then when you're the one doing it and you're in control of the situation and you're in charge, it really is a different thing. So, just trust that comfort comes with time, and it makes it a little bit easier.
Thank you. So since we do have like a little bit of time, we have the questions from Instagram and also like YouTube. So like
Yeah,
I can just go through them and you can answer as many as you can.
yeah, please.
Um, so, the first question actually has to do with what you did during like your gap year. So you said you like worked at a dental lab. So like how did you go about getting that job and what did you do like on like the everyday basis?
Great question. Love this question because I think that it's such an underrated opportunity if you can find it. I got lucky. The lab that I worked at, one of the people there, the techs that was staining and glazing crowns, right? So the crown that goes in someone's mouth when it's first made or milled, because they're all milled now, it's just this, whitish, yellowish tooth that has no character. It's not shiny or anything. And you have to stain it. So you're putting the color on it yourself and then you're glazing it, just like pottery, right? Okay, listen, there's a lot of arts and crafts in dentistry. Okay. If you don't like making things, it really might not be the right field for you just because that's a lot of what we do. Or you like blood and guts because then you could be oral surgery and that's fun too. But what I will say is, you can always call labs near you and see if they need anybody. I actually started out during college as driving for them. So the labs need to get the crowns that they're making to the dentists that they're making them for. So I was delivering it. So I was, dropping them off at 15 offices all over Delaware. And it was really fun. I'd go pick up Chick-fil-A, sit in my car for a couple hours, drop off a bunch of teeth. But then when someone went on maternity leave, I was able to step into that role. And so, yeah, that's how I did it. It was great. You also learn how to do things that other people panic about in dental school, like pouring up models and, working with those materials. So I don't know. I hope that answers the question.
No, it does. Thank you. That's awesome. Next question. What are some dental instruments you use on the daily?
On the daily, well, there's a lot of them. It depends what I'm doing.
Mhm.
Well, for every exam, is this like a technology question? Like, do you want to know what cooler stuff we're using?
I think like more hand instruments, like you would find in dental school as well.
Okay, so we've got things like, you always have your mirror. One of the things it's so hard right away. I will just be straight up. Never panic in dental school. Looking into a mirror to see a little tiny thing on a tooth in reverse, indirectly, is very stressful at first. You'll get great at it. Don't worry about it. So you always have your mirror. You have an Explorer that has a perio probe on one side. So you're measuring. I'll go into this. I'll just explain it as I'm going. So you've got an Explorer one side, which has a pointy end, right? That's that little hook. And on the other side, you have a little measure because in your mouth, you have to measure everything in millimeters. So that's really useful. There's always some cotton pliers, which are like little tweezers that you can use to pick things up or grab onto something. You have your drill, so you're always using drills. You've got a high-speed drill and a slow-speed drill because depending on what you're doing, you don't want your drill necessarily to go at 200,000 turns per second. Maybe 50,000 turns per second is plenty. So you've got those. If you're doing extractions and you've got forceps and you've got elevators and there's this question has a never ending answer. There's so many instruments, there's not the limit does not exist. And then if you go to a dental convention, they will try to sell you 3 million new instruments. So they're always inventing something new, right? There's always somebody who's like, I'm doing it a little bit differently. And you're like, you just made it shiny. And they're like, yeah, but it's different. So
Oh, that's funny. Okay, let's see.
just so you know, you don't need to buy stuff for dental school. Don't buy stuff for dental school.
Oh, okay.
Your
Okay.
dental school will supply and give you everything that you need. And don't do it. If this question is because you want to buy stuff for dental school, don't do it. You'll want totally different stuff when you're out anyways. So
let's see. How did you personally study for the DAT for somebody that's about to like start? What would be like your guidance for them?
I was trying to think of this actually because I was going to include it. And I can't remember exactly. I want to say, hold on, I'm going to look it up on my phone. I think that I used Kaplan.
Okay.
I want to see if I recognize the cover of the book. I think I'd use the Kaplan program, and you can do Kaplan to like go through their program.
Mhm.
And then there's Crack the Dat. I've heard great things about,
Mhm.
and like the boot camp and stuff. I think that I did end up downloading. I went through, I think, the Kaplan book, I want to say twice.
Okay.
Maybe twice, 1.5 times. And then I ran out of things to do. And so I did the other aspect. I did Crack the Dat for practice exams, I want to say, extra exams.
Like how long? Like over like what span?
How many months? I
Okay.
would say I studied for 3 months exactly,
Okay.
which I think is,
Mhm.
maybe on the shorter side of average.
Yeah.
I don't know, maybe it's average. I just remember that because I studied all summer. Because I'd already graduated, right? Because I did this in my gap year. And I was living on campus still, so I could use the library on campus. My lease hadn't ended
Mhm.
for my apartment. And I was in the library every day in the summer alone, having a fit, being like, this is the worst.
Oh, I can't imagine yet.
It's a lot, but do it once, study your
Yeah.
butt off once. You don't want to have to take it twice, because then you're just like, oh great.
Ugh. Yeah, hopefully.
Totally. If you do have to take it twice, it's totally fine, just so you know.
Mhm.
I had a lot of good friends in school who took it 3 times, and they'd applied to dental school 3 times. So if that's you, doesn't mean you're never going to get in, but
Mhm.
it takes it's the emotional stress of it that'll get to you than anything else.
Let's see. Mm, uh, after dental school, well, after for you residency, how easy or how quick was it for you to get like a job in the dental field?
Um, this is interesting. So I ended residency July of quarantine.
Okay.
So it was actually kind of easy. Does that make sense?
Mhm.
But here's the caveat. So one of the mistakes I think that people make is that you need to recognize that everyone you meet, once you get into dental school,
Mhm.
every single person you meet is at some point going to be a colleague of yours. Okay? Yes, they're your professor, but 4 years down the road, you're on the same level as them,
Mhm.
right? So really, always kill everybody with kindness. You don't need to be the person necessarily stirring up trouble in dental school,
Mhm.
because everybody knows everybody in dentistry. And those relationships that you form with people, those are going to help you get a job. And that was really where I was at, especially because it was difficult during the pandemic. I couldn't visit Boston.
Mhm.
I knew I wanted to move back to Boston from Chicago. And so I reached out to a bunch of my connections from Boston who were all old professors. I reached out to the dean who I'd stayed in touch with, people that I was like, hey, I feel like you know a lot of people. If you know anyone who's hiring, let me know. And because they knew me in a good way from dental school, people were really more than happy to help out. So that's how I did it. And I would say that it was easy, but I had laid the right groundwork for it to be easy.
Okay. I see.
Yeah.
Because somebody else asked also like how important is like networking within the dentistry field. So I think this
So
definitely
important.
plays a role with that. Yeah.
So important. So important. So I think that I can tell you that everybody knows everybody. And even this past week, I met someone who randomly asked me, because they saw the signature on my email, okay, which says the office that I'm working at. And they said, oh my God, do you know, she's not a dentist. And she said, oh my God, do you know this person? And it ends up that another dentist that used to work there is her next door neighbor, and she babysits her kids, right? So networking is really, really important, but it's also really important to maintain a good reputation, because everybody knows everybody in dentistry. So, you know, I think that it's not hard to do. It's just something that you just have to keep in mind early on.
Yeah, for sure. See, next question. We actually have one from the YouTube channel. Somebody was asking, as far as recommendation letters go, what would look better? A letter from like a local dentist that you maybe shadowed with, or a highly acclaimed dentist that you might not really have a good relationship with, or does it not really matter?
No, highly acclaimed dentist.
Uh-huh.
No. If you don't know this person, get out of here. They want to know that they want, also, if you assume that they're a highly acclaimed
Mhm,
dentist, by whose standards,
mhm,
right? What if you're relying on that and the person interviewing you has no idea who this person is? Keep in mind that the person who's reading over your application,
mhm.
they could be an 80-year-old dentist that doesn't know how to work social media.
Mhm,
So I would absolutely say dentists in your area.
mhm,
If you think that you want to go into, and I know that it has to be a lot of the hours are required to be general dentists.
mhm,
Um, but let's say you already know you want to go into oral surgery.
mhm,
You've already done some research maybe with like oral surgery based stuff in undergrad.
mhm.
Then maybe your letter also comes from, maybe you have one that also comes from an oral surgeon. But people that know you well and know your work ethic and can write a letter attesting to how great of a person you are is, I think, better than someone who doesn't know you.
Yeah, absolutely.
Yeah.
Let's see. So, like I think you'd mentioned earlier in your presentation that you like while in dental school, you like interviewed pre-dental students that were applying, right?
Yeah. Yeah. Yeah.
For you, like just as somebody interviewing them, what was like things that stood out to you, like for like good applicants?
That's such a great question. Definitely, uh, you know, people who, you don't have to be the most chatty person. I'm obviously kind of a chatty person, but so being friendly and having prepared answers, right? So no winging it. Have a friend go over stuff with you, go over lists. There's so many lists online of like proposed answers for interviews. Um, and having answers to things. Sorry, I don't know if you can hear the beeping. My laundry's done. So embarrassing. Um, just having good answers ready. Things like, uh, how did you decide you wanted to become a dentist? That should be a really easy question to have a good answer to. And if you don't have a good answer to why you decided to go to dental school, you're going to be way less likely to get that acceptance letter than the person who comes in next, who's like, I might have only decided 2 years ago, but as soon as I knew, I shadowed all these different people to make sure. I, have been, even though I didn't know it was dentistry, I volunteered at a local hospital for the last 10 years, right? Or 5 years, whatever it's going to be, 10 years, you'd be in middle school. Things that you've got lists ready to go. I don't think that as an interviewer, it's fun to feel like you're, pun intended, extracting information from
Mhm,
the interviewee, right?
mhm,
We want to see that you're excited to be there and that you can't wait to tell us why you're the best applicant, right?
yeah,
So I would say that that's probably a big part of it. Also when you're going to interviews, show your personality, but you don't need to show up with like the wildest outfit thinking it's going to make you stand out. That is not the day for it. I'm all for a pantsuit. I wore pants to my interviews. You don't need to wear a skirt. Boston's, 11 degrees out today. But, be practical. I think dentists overall are a pretty practical bunch. You
mhm.
don't want to be memorable because of your shoes. You want to be memorable because you were really qualified. So that's just a personal opinion. If you want to go for wild shoes, do it, but also make sure that you're qualified.
Yeah, absolutely.
Yeah.
Um, Something that also goes along with having a good interview is obviously having a good personal statement. And
Yeah.
especially like right now as a pre-dental student, like I don't even know where to start with that. I'm not gonna lie.
Oh my God. Let's talk about it. Let's go over
Okay,
it.
yes, let's absolutely talk about that.
Let's talk about it. Okay. So my method when I was writing my personal statement,
Mhm.
Was I like to word vomit a couple times.
Okay.
So I'll just start typing kind of, I'll get an idea in my head. Maybe I want to start with kind of like a pseudo story. We can use the example of me passing out in the emergency department. Okay. That's one. Maybe I start writing that story saying, you know, that's when I knew that emergency medicine wasn't for me. But
Mhm.
a new thought occurred to me. I really liked whatever. This is so stupid. Nobody don't use this as an example. But you get to a point where you go, that's not it, and then start a new train of thought, right? Start at a different part in your story to becoming a dentist, right? And eventually you're gonna start making your mind
Mhm.
run a little bit faster in the right direction. Don't don't feel like you need to write the perfect personal statement the first time.
Mhm.
You can write three different personal statements. Does that make sense?
Yeah, that makes sense. Yeah.
I know it's not that helpful because it's kind of
Mhm.
vague, but I don't know anything else about you, so I can't
Yeah,
like.
no, don't worry about that. No, I think it's definitely good to like brainstorm and just kind of, like get it all out.
Yeah, like I think I would start out thinking, what was the moment that you decided to become a dentist,
Mhm.
right? Because there's, even if it's not like a moment, there was an evolution, right, in your
Yeah.
train of thought.
Mhm.
Maybe for some people there was a moment. Maybe they knocked their. A lot of people have, knocked their front teeth out
Yeah.
when they were 10 years old, and it's been a
Mhm.
lifelong issue. But in the process, they realized, oh, I want to fix people's front teeth when they knock them out.
Yeah.
So maybe start with writing down that story and seeing how you can turn that into an explanation for why you would then make other people
Mhm.
in your situation, right? Someone who's not a dentist,
Mhm.
be really comfortable in the dental chair.
Yeah.
Because that's kind of our job, right? People don't want to see us.
That's true.
It's true.
Okay, let's see. What time is it? Oh, okay, we have like I think time for one more question. I'll make this one a good one. So obviously, like you said, like you were like the top of your class with clinical experience.
Yeah.
And so do you think there were any skills that you had prior or just things you did before coming to dental school that might have made you stand out clinically at dental school?
Um, that is an important thing. And that is something they always ask, right? How do you, it's important to have good hand skills when you're here. Did you play piano? Did you do something growing up that can you, there's so many examples that people use and they stretch it a little bit, right? Someone will be like, you know, I learned to knit 2 weeks ago. I have great hand skills. And we're like, oh, yeah, that kind of counts. But I think that for me, working in a lab showed them that I could work with things that were tiny, right? Because I was, if you're painting teeth that are this big, that's great. Um, if you're someone who likes sewing or needle pointing or something like that, that's of course something to put on there. If you've ever played an instrument, that's great. Hand coordination, talk about that. That's fantastic. If you're artistic in any way,
Mhm.
even if you've never done something with your hands that's, on a really small scale, you know, maybe you were in art clubs in high school. Maybe you made those friendship bracelets really fast when you were at camp when you were young. There's so many different examples of things it could be.
Mhm.
I made so many friendship bracelets when I was young.
Yeah.
Yeah, right?
Yep.
Great example. So I think the hard thing about deciding to become a dentist is that you can't get a job as a dentist and try it out before you commit, right? That's the hardest thing. So you just need to kind of look at what you've done and say, I am kind of artistic. I do like building things. Maybe you were in shop class and maybe you just have that a brain that can picture things before they've actually been made, because that's what we do too, right? We make something out of nothing sometimes. So I hope that kind of helps. I don't know. For me, I was in a lot of art classes. I always did studio art. And I definitely quit playing piano when I was in middle school. That was not it for me. But I had enough other things that I knew that wasn't going to be a challenge for me.
Okay.
Yeah.
Awesome. Yeah, that definitely helps. I think, especially with manual dexterity and just
Yeah.
picking up all these skills like early on, I think it'll help everyone for
it
sure.
helps a little bit along the way. It's if you're someone who always hated all of those things that I just mentioned
Mhm.
and you don't want to do any of them,
Yeah.
maybe dentistry is not,
Yeah.
maybe it's not the right thing for you. Maybe it is, but like you just have to look at what your interests are because you can end up doing fillings forever, which is totally fine. But if you don't like that kind of thing, then it's not for you probably.
Absolutely.
Yeah.
Unfortunately, I think we are out of time now. So whenever Gabby is ready, she can end the stream.